So do vibration plates really work? Not gonna lie, when I first started to see these things pop up in clinics and on Amazon and in commercials, the first visual in my head were those 1980s ads where women were standing on these machines that were shaking their body and kind of melting the fat away. So if you're someone who's a little bit skeptical of these things, I completely understand. But the good news is there have been some articles that have come out recently looking at some research studies as to whether or not vibration plates have a beneficial role in post-stroke rehab. And so that is what we're gonna go through in today's video. Now, I'm not telling you anything new when I say strokes cause a lot of problems. They cause problems with balance, and they cause problems with strength and sensory issues and spasticity and abnormal movement patterns. And yes, on this channel, I spend a ton of time breaking down skills and showing you drills and exercises to build those skills back. And absolutely, those are foundational principles that must be applied if you want to restore function. But for many of you, you're doing the drills and you're doing the exercises and you're still having problems with your balance and you feel like you're just kind of plateaued. And that's where I think vibration plates might have a role as a beneficial tool in some situations and circumstances, but not all. So I promise you, you're gonna want to stay till the end of this video. In this video, we're gonna talk about what happens after a neurologic injury, mechanistically, the benefits of a vibration plate, like what's going on in the nervous system when you stand on a vibration plate or you apply vibration to the body. And finally, how we can take the information in these studies and apply it to your situation so that you can decide whether or not this is a beneficial tool to add to some of the exercises you're already doing. If you're new to this channel, I'm Tara, I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset with the end goal of empowering you with as many tools as possible to take full ownership of your rehab and your overall health. We first need to lay a little bit of a foundation for some terms or some concepts that I think are really important before we dive into the meat of vibration plates, when they're useful, and how to use them, and that is muscle spindles. So what are muscle spindles? Muscle spindles, for those of you that have been around for a while, this might be a little bit of a review, but muscle spindles are just specialized muscle fibers that are embedded within a muscle that sense muscle lengthening and speed of lengthening. So why do we have these in the muscles? There's a few different purposes for these muscle spindles. One is protection. So if a muscle is lengthened too quickly, the muscle will immediately respond, or the nervous system will immediately respond by contracting that muscle. The other one is motor coordination. So when we're standing or when we're moving about in our environment, there's a little bit of tension that lies within all of our muscles. And so the way the muscle spindles involved, there's a few mechanisms that help for us to maintain vertical and to perform coordinated movement. But the way the muscle spindle is involved is it keeps a little bit of tension in all of the muscles. So if you think about all the muscles as kind of just like guy wires that are kind of controlling the bones of our body, like a marionette puppet. When one pulls, another one has to give, and this little like give and take that helps to keep that little bit of tone in our body to allow us to perform coordinated movement. The muscle spindle in part is involved with that. The other one is body awareness. So muscle spindles, because they can sense when a muscle is getting longer, can also give the brain information about where our limbs are in space, which can also be really valuable. Why this matters when it comes to some of the movement problems that happen after a stroke will be easier to understand if we understand kind of the mechanism behind muscle spindles. So muscle spindles, again, are these fibers. They're wrapped in a nerve. This nerve goes to the spinal cord. And then in order for this muscle spindle system to be really effective, we want a quick, almost immediate response. So this muscle spindle immediately at the level of the spinal cord will activate a motor neuron that goes to that same muscle to contract that muscle. right at the level of the spinal cord. So no information has to go to the brain at that point. There's this instantaneous mechanism in place to help us, like let's say if you're falling or a muscle is just being lengthened too quickly, to contract. Now there's another component of this kind of neural network at that spinal cord level where another nerve branches off of that, or another signal is sent off of that muscle spindle to the antagonist. So let's think about the bicep. The bicep bends the elbow up. If the biceps lengthen too quickly, that activates the muscle spindle, sends an immediate response back to the bicep muscle for that muscle to contract. But at the same time, we also have to inhibit the tricep, because if two muscles are contracting at the same time, a limb would go nowhere. It'd be like having a guy wire on both sides of that bone. It's not going to go anywhere. So that little neural network right at the spinal level also sends an inhibitory signal to the tricep. That's going to become important when we talk about vibration and how that's involved in how the muscle spindle potentially is involved with vibration plates and stroke, and how potentially they can improve movement after a stroke. So inhibition of the antagonist, that's also a very important component of the muscle spindle, like little neural network. At the same time, there is a signal that's being sent up to the brain. Consider this like a little branch off of that little neural network that sits at the spinal cord level. This has two functions. One is that, again, it gives our brain information about where our body is positioned in space, but also it activates an inhibitory signal coming from the brain that can override that muscle spindle. So if you think about the brain as like the main operating system where all the big decisions get made for the company, there needs to be some signal or some information about what just happened at that muscle level going to the brain, so that the brain can be like the executor and decide what events need to occur based on that information. One thing the brain does is it sends an inhibitory signal back down to override that reflex. And that's the important part when it comes to why do you have these involuntary contractions after a stroke? It has more to do with that mechanism that's involving the brain, obviously, because the brain is where the injury has occurred if you've had a stroke. But to further understand like this inhibitory system, it's easy when you can visualize babies and how they develop. Initially, they're all reflexes, right? They're just like, you tap their feet on the ground and parents get really excited because they think their baby is jumping and doing all these crazy things. That's basically just an involuntary reaction. When you really start to see a baby moving in a coordinated manner, the way that happens is because of the inhibitory systems that come online in the brain. So when we're first developing and we're learning, or the brain is developing and we're gaining more coordinated movement, it's not that the brain is learning how to coordinate all these muscles. It's actually that the brain is, these inhibitory signals are coming online in the brain and can allow a baby to crawl and do more of these coordinated movements, right? So that requires a lot of inhibition. Now, how do we connect this to a stroke? Think about what happens to you when you tap the bottom of your foot. When you're sitting, you'll notice your leg is jumping because your foot is doing these little pointing motions, these very quick pointing motions. Now imagine that baby and the parents are tapping their feet on the ground and they look like they're jumping. That reflex, it's a similar mechanism. You're just not getting any of that inhibitory control coming from the brain. That, in my opinion, is the explanation that makes the most sense to me. There's still no definitive explanation that this is 100% why spasticity happens after a stroke. Like, there's just a lot of theories out there, but this one involving the reflexes really makes the most sense to me, or the muscle spindles. That's the theory that makes the most sense to me as to where spasticity comes from after a stroke, or why it occurs. So now let's talk about a stroke. What happens after a stroke? Lots of systems are taken offline because of this damage in one area of the brain. Lots of neural networks are affected or impacted, but what is this affected? It can affect sensory nerves, it can affect motor signals, it can affect association areas of the brain where the brain processes a lot of the sensory information coming from the body, but also integrates information to send a signal out of the brain. And all of this can affect coordinated movement. It can affect your brain's perception of where your body is in space. And of course, it can affect your balance, movement quality, gait, ADLs, the whole 9 yards, if any component of that neural network involves that damaged area of your brain. So coming back to now you've had a stroke, and what's going on at the muscle spindle. The muscle is sensing that rapid lengthening of a muscle. So like, let's say you're stretching your bicep and you rapidly pull your arm down straight. That's going to activate the muscle spindle. That's going to send a signal to the spinal cord. The spinal cord is going to immediately respond by, one, contracting the muscle that it just got that signal from. So if you rapidly lengthen the bicep, that signal is going to go right back to the bicep muscle to contract it, and it's going to inhibit the muscle on the opposite side. What does that look like in the ankle? You're going to activate the calf muscle, it's going to point the foot down, and then it's also going to inhibit the muscles that bring the foot up. That's the muscle spindle. But where this becomes a problem is because of that damage up high in the brain, you're not getting that inhibitory signal coming from the brain. Remember I said there's a little bit when that muscle spindle is activated and it's doing its thing, it's also simultaneously sending a signal to the brain. The brain is processing that information, and in most cases is sending an inhibitory signal back down to the muscle to override that contraction that's occurring in the bicep. After a stroke, that inhibitory signal is blocked, and that's where spasticity increases. I promise you this is important because it will help you understand who vibration plates are appropriate for and when they should be implemented in a physical therapy treatment plan. Okay, so hopefully now we understand muscle spindles in healthy individuals. We understand what happens to the brain after a stroke and how that muscle spindle system is affected, which in turn results in involuntary contractions in the muscles, primarily bicep, wrist flexors, ankle plantar flexors, pointing the foot down. So now let's talk about vibration plates and what the potential mechanism is that might be beneficial in certain situations for people that have had a stroke. Vibration stimulates that same nerve as part of that muscle spindle that sends the signal to the spinal cord. Vibration stimulates that same nerve. So one theory is that what this does is it kind of, because that vibration is continuous, you're kind of like wearing out that nerve, and so it eventually just gives up. That's one potential theory. So you're not getting that immediate contraction because it just gives up. Another theory that does make sense to me is that vibration inhibits the antagonist. So this isn't necessarily for the vibration plate, but might explain why vibration, like massage guns, potentially could be beneficial if you do it to the antagonist for spasticity, because then you would get a relaxation. If you did it back here, technically you would get the bicep to relax, right? That's one potential mechanism. But more than that, you would also maybe stimulate the muscle spindle on this side, which also, if the tricep is contracting, that further could decrease spasticity in that muscle. So that could be one potential of just massage guns, but we're talking about vibration plates for the studies that I looked at for this study, or for this video. But potentially, that's one mechanism. They know the vibration plate stimulates what they call the 1A sensory nerves, which is the nerve that's involved in the muscle spindle. that is triggered when a muscle rapidly lengthens, creating that immediate contraction of that same muscle. But remember, I also said the muscle spindle, when it's stimulated, it also sends a signal to the brain, right? And this is where the gold occurs, in my opinion. You stimulate that neural network locally via that muscle spindle. And yes, you're getting some of that muscle contraction at that level. But what's more important is you're getting a signal that's being sent back up to the brain. So this is where potentially there could be some value in vibration, because you are increasing awareness of that limb and where that limb is in space, but also potentially you would get a motor response from that sensory input. So that's big picture. That's just giving you a little bit of a deep dive as to what's going on under the skin before a stroke in healthy individuals, how the body is so perfectly designed to be able to move and navigate through the world. Hopefully you found that informative. But now let's talk about the studies. There was a meta-analysis, which a meta-analysis is basically just a study of studies. So it'll look at studies that have already been done in a specific area and analyze those studies to see, in this case, are vibration plates beneficial? And they looked at several studies that had been done using vibration plates with people that have had a stroke. And what that study in 2019 found was that it did not have an impact on improving muscle coordination, balance, gait, or postural control. But they did show, or they did say, that there's enough evidence in those studies to suggest there was a decrease in spasticity. Now, I'm always skeptical when I look at studies of like treating spasticity and they're doing like a manual test to assess how spastic a muscle is, which is like a test that we do in the clinic. There's a lot of room for error in how that test is performed and how a clinician is assessing the response in the muscle when you move it. So it's called the modified Ashworth scale. I don't know if that's like the best way to measure spasticity, because there is like so much subjectivity involved with that type of a test, but that's the test that they did in the studies that they analyzed in this meta-analysis that was done in 2019. And they do think there was a meaningful effect on spasticity and potentially bone density, which makes sense because of that vibration motion. You're getting these little micro pulls on the muscles, or on the muscles pulling on the bone, and that could potentially help with bone density. But a little disheartening when it comes to like overall like outcomes that potentially you all care about: postural control, gait, balance, movement, coordination, things like that. They didn't see a lot of value. So there was a study done in 2024, that is how this all started, was the inspiration behind this video, that says that vibration plates do improve balance, gait, and overall strength. So what's the difference? Well, the study that they did in 2024, they compared conventional physical therapy, and I'll talk about what that meant, or what they termed conventional physical therapy. And they compared that to conventional therapy on a vibration plate. So same interventions, same exercises. There was just one group that did it on the vibration plate, and there was one group that didn't do it on the vibration plate. Now, the way this study that they did in 2024 differs from the study that they did in 2019 is most of the studies they looked at in 2019 were passive. People were either just standing on a vibration plate, or sitting on a vibration plate, or standing and doing like a little bit of a side-to-side weight shift on a vibration plate. And that's where they didn't see any improvements in balance, motor coordination, postural control, which now that to me makes sense. The vibration plate in and of itself, if not combined with some sort of a movement retraining activity, is not beneficial. And that's key point number one that I want to be very clear about if any of you decide you do want to purchase a vibration plate, as far as how you should use a vibration plate. Yes, vibration is beneficial for spasticity. And actually, even reading that meta-analysis, I'm probably more of a believer in like massage guns than I probably was before, and I'll probably use them a little bit more. I have a couple of massage guns. I don't use it as often as I could, and I don't think I talk about it enough on this channel. This meta-analysis makes me a believer. So I might be recommending massage guns a little bit more, and just standing passively on a vibration plate or sitting on a vibration plate. Now, if you're trying to reduce spasticity in your ankle, which remember, this meta-analysis in 2019 showed that a vibration is an effective intervention for decreasing spasticity. I would say if that is your goal, then and it's the spasticities in your leg, I would stand on a vibration plate. I don't think sitting on a vibration plate is going to have a lot of impact on the plantar flexors, the muscles in the lower leg that are pointing the foot, if you're sitting and you just have your feet on it. I think it'd be better to stand. So, but if your goal is to reduce spasticity, vibration plate, do recommend. Massage guns, definitely becoming more of a believer. But if your goal is you want to improve your balance, you want to improve your postural control, and you want to improve your strength, I do think that this 2024 study, although small, but that's the case with all stroke studies, they're very small, and I think this one had 44 subjects in it. The meta-analysis they did in 2029, I think all the studies they looked at had anywhere from like 20 to 60 subjects in them. So these are all very, very small studies. So take this information, keeping that in mind, but doing a vibration plate with what they're considering conventional physical therapy. Now, both groups did the same conventional physical therapy. The only difference was one group did conventional physical therapy, we'll go into what that means in a second, on a vibration plate, and the other group did not do it on a vibration plate. And I think this is very, very, very important. So what was the conventional physical therapy protocol? It was a combination of NDT, which is a neurodevelopmental technique where, simplified, just because I'm not going to get into a long explanation, that's like the quality movement, working on like postural control, really making sure that everything stems from like good quality movement. That's extremely simplified. MDT is a lot more complicated than that, but it's really facilitation of like postural control and just facilitating normal smooth movements. Again, very simplified. But the conventional treatment group also included leg strengthening, sit to stand, squats, quad sets, weight bearing, which included forward lunges, and then front, back, and lateral weight shifting, static and dynamic standing balance, visual deprivation in standing. If you all have been around for a while, a few weeks ago, maybe it was a couple months ago, I reviewed a study that just looked at visual deprivation, and yes, I'm a huge believer. I think it will definitely improve your overall balance and balance confidence. And then stepping exercises. Again, the only difference was one group did it on the vibration plate, one group did these activities not on the vibration plate. And what they found, both groups improved, but the people that did it on the vibration plate had a greater improvement from pre-test or pre-intervention to post-intervention. So there's two things that I really think are the take-home messages from this. If physical therapists were just doing this protocol, you would see clinically significant improvement in just this protocol that I just went through, which most facilities are not doing this. So, link to this article will be in the description. Take this into your physical therapist and say, listen, look, this is what they're calling a conventional physical therapy protocol for post-stroke. And just hand them the article. So that said, even if you didn't use the vibration plate, if you just did these interventions, you would see clinically meaningful improvements. But they saw greater clinically meaningful improvements when these interventions were done in combination with vibration. Now, I will go a step further for a lot of you that just want like a lot of tools in your toolkit. I think potentially, given the mechanism of why they believe that they saw these improvements and everything that I talked about earlier in this study, I think maybe even doing a combination of like massage gun and standing on a vibration plate. So maybe for like more like working on arm movement and things like that, where the standing on a vibration plate will have some impact because you are getting that vibration. If you've ever stood on one, you are getting that vibration through your entire body. But maybe the combination of a massage gun and the vibration plate and doing these conventional treatments, again, link for the article is in the description below, and they list out what conventional physical therapy is, might be the sweet spot and really taking your movement quality, your balance, and your walking to the next level. So long story short, moral of the story is do your exercises on a vibration plate and you are probably supercharging your potential for restoring normal movement. That is it for this video. I will put a link for the vibration plate that I use in the description below. I've had it for a few years now and it works great. It allows for the 20 to 30 hertz of the vibration frequency or intensity that they mention in this article. So it's ideal for that. Full disclosure, I am a partner with the Amazon Partner Program. So when you click on that link, I do receive a small commission. If you want to support this channel and you wanted to purchase that, it would mean the world to me. And I thank you in advance for your support. If you really want to take your rehab to the next level and you feel like you're overwhelmed and just kind of like grabbing at straws as far as how to set up your treatment plan and kind of where to go next, and you feel like you're just bouncing from physical therapist to physical therapist, those are the reasons why I've created our membership program. As a gold member, you get access to all the exercises that I give to my patients that I see in person, which are all very specific to neurologic conditions, as well as access to a discussion board that I check in on every day. So if you wanted to ask me questions, you can post those on our discussion board. As a gold member, you also get access to our monthly Q&As where you can get your specific questions answered, and you get access to our monthly webinars. So if you want a little bit more clarity and a little bit more direction and feel a little bit more in control of your rehab, and you don't want to feel like you're dependent on when the next physical therapist can renew your plan of care and having those interruptions in care, if you want something with a little bit more consistency, I highly recommend you check out our membership programs. You can do that by visiting rehab-hq.com. When you go to our website, you can see a much more detailed description of each membership program, but you can also schedule a discovery call where you can talk to someone in person. You can tell them about the problems that you're struggling with as far as getting your rehab to the next level, and they can help you decide if our program is right for you. Again, visit rehab-hq.com. But that is it for this video. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.